SRM Institute of Science and Technology, Engineering, Medical and Health Sciences, Management, Dental, Science and Humanities, Law, Agriculture Sciences, Hotel Management. Admissions open.
Good morning, everybody. Vanakkam, and welcome to the SRMIST and the Hindu webinar today. The topic of the webinar you've just seen is the impact of the pandemic on medical education. So the last 1.5 years has been years filled with hyperbole and uncertainties. Unprecedented, unparalleled developments that held us paused in our daily activities and made us think about what we could do in the future. And at the center of this, in some sense, is the student community. Students have had a number of questions about the way ahead, the path ahead. And in addition to the usual uncertainties that a child faces before he enters his chosen profession or chosen line of work, there are anyway a lot of questions. And this year, there are many more questions than ever before, all thanks to the pandemic. Kids who have written to us have asked whether it is safe anymore to be a doctor, whether they would have to do back-breaking 14-hour, 24-hour shifts every day in hospitals. What is the possibility of getting into a hospital? There are a number of questions which our eminent panel will be able to answer in large measure today. And without any further ado, let me welcome our panelists and let me give an introduction to them just in order not to break the flow of their speech. So we have with us Professor Lieutenant Colonel Arunachalam Ravi Kumar, who is the Pro Vice Chancellor, Medical and Health Sciences, SRM Institute of Science and Technology. Welcome, sir. He was formerly the Director and Head of Clinical Services, ENT, Dean of Education of 12 faculties at Sri Ramchandra Institute of Higher Education and Research. And as just before this webinar started, he was talking about his experience with mucormycosis, which, given his specialty, he is quite an expert in. He has had a number of awards and has held a lot of positions in bodies across the country. He has also been an assessor for NAC, the National Board of Examinations, and member of the Bureau of Indian Standards. He has been awarded many awards and has a number of publications to his credit, besides being a PhD guide for a number of students. We welcome you to our event today, sir, though it is as much your event. We have with us also today Dr. Bhuvaneswaran, who is a health administrator, an accomplished cardiologist with excellent academic laurels. He graduated from Stanley Medical College, Chennai, and took his cardiology post-graduation from the renowned Sri Chitra Tirunal Institute, Trivandrum, all through as a best outgoing student. He was a medical director as well as HOD and professor of cardiology at the PSG IMSR, Coimbatore, India, a 1,000-bedded teaching hospital offering undergraduation and post-graduation courses in medical sciences. He is a pioneer in radial coronary intervention since 2003 and the first one to perform the same in the UAE. And he has served as principal investigator for the international GCP research studies. He's a member and fellow in various national and international cardiology councils. He has an MBA in hospital administration too, to his credit, and has had an overseas stint as a medical director and head of cardiology in Ahalia Hospital, Musafa, UAE. Currently, he is director of PSG Super Specialty Hospitals, Coimbatore, a center for high-tech medical excellence. In addition, he is also a stage singer in light music and has given various programs and has also released a few CDs to his credit. Welcome to our event, Dr. Bhuvaneswaran. We all have with us Dr. S. Rajashekaran, who is the chairman of orthopedics, trauma and spine surgery at the famous Ganga hospitals in Coimbatore. It is one of the largest specialty centers for orthopedics and plastic surgery in South Asia. He is the current international chair of AOS Spine, the largest international spine society in the world, and is past president of SICOT and many other international bodies. Apart from his clinical work, he has also pioneered internationally recognized research work in his chosen field. Welcome to our event today, Doctor. We will start today's event. Let me give you a small overview of what will happen. Our three speakers will have about 10 minutes each for their presentation, and then the floor will be open for questions. The question and answer, please type in your questions even as the session starts. Some of our experts might want to answer online. And we'll also have a question and an answer session, an elaborate one, where we will throw some repetitive questions to the panel and they will be able to answer it. Thank you so much, Dr. Rajashekaran. Floor is yours.
Thank you, Mrs. Ramya Krishnan. And I should tell you that this is a good opportunity. And right from my young age, we have always been associated with Hindu, a great admirer of Hindu. And let me congratulate you and the SRM for doing this wonderful work. And I think this is very timely. And that's my first thought. Because the whole world has been taken over by one small, tiny virus. And sites like this are very, very common. Empty roads and people being distanced. And this is a different world, and this new nomenclature, new normal, has been started by this virus. So one small virus and has affected more than 200 million with more than 2.5 million deaths. And we all thought it was over last year. And then another tsunami of the second wave has come. People are talking of a third wave, and that's actually putting a lot of jitter into all of us. And the one thing that in top of our mind now is people who are doing +1 and +2 and looking at their future, looking at their education, and they are wondering what is the impact of all this on medical education. So I would like to actually start from the very beginning. Mrs. Ramya actually said that there are a lot of questions about how to go about medicine and what to do. But the first question is actually, in the time of this pandemic, is medicine a good option at all? And that's actually in top of mind of many people. Because it was not like 30 years before when Dr. Ravi Kumar, Dr. Bhuvaneswaran and I did medicine, where only there was medicine or engineering. Children now have a lot of good options. The ever-present engineering and IT, but also now the finance management, businesses, artificial intelligence, and data analysis, all these are there. And when you have all these, the question comes begging, is there a scope for medicine in the times of pandemic and afterwards? And I am a surgeon for more than 30 years. And I can tell you one thing for certainty, that I want every good student to have the option of becoming a medicine, because medicine will be a profession for you where the society needs you and you don't need the society. And if you are good at it, medicine is an evergreen profession. Because for as long as humanity is there, there will be illnesses and diseases, and there will be a demand for, let me put in inverted commas, good doctors. And you should aim to be one. Especially in a country like India, where we are facing a severe shortage of doctors and nurses. And this has been from the CDC in US, where they say that 600,000 doctors are required. And you look at it, and there is also a lopsided ratio in our country. In some of our states, it's going to take another 80 years for us to reach what is required. So if you become a doctor, you will be always needed by the society. You will be a respected person. You will be a sought after person. And that is one of the reasons you should definitely consider becoming a doctor. There is another reason which you have to always adopt when you take a decision on what you're going to do with your life. You need to have a subject which will keep you fascinated your entire professional life. And there is nothing better than medicine to do this, because you will be working with the human body, which is one of the most fascinating, intricate, and complicated system in the whole universe. And to read about this and to deal with this and to look at it and to cure it is going to be phenomenal. Now, these are the diagrams which are drawn by Leonardo da Vinci many centuries before, but the wonder of how he gave is still there. Even today, we are talking of sophisticated computers, sophisticated machines, sophisticated mechanics. But let me tell you, even the most sophisticated robot cannot match a simple function, locomotive function. And even an artificial hand of many millions of dollars worth is not as good as a simple human hand. So human body is not replicable, and you will be dealing with this wonder machine created by God. Reason number 3 is medicine is still a profession of trust and honor. And this I am telling with the conviction of having been in this profession for more than 3 decades. Medical professionals are trusted across the board. Now you can see Gallup and Forbes are the 2 major opinion polls around the world. And consistently, year after year, 3 out of the top 5 most trusted professions and respected professions are in the medical field. Doctors come in number 2 after nurses, and pharmacists rank at number 4. If you're a doctor, you will always find that you are always respected and looked up to. Now, pandemic is a good example. This virus closed everything. It even closed the places of worship. But because of doctors, places of healing and cure, hospitals are open. And for that, the whole world clapped for us throughout. And you will always be looked up to. In many of the European places at the time of pandemic, whenever there was a doctor going, the whole people in the city always clapped and gave them a preference. So you will be a respected person in the society. Reason number 4, if you become a doctor, I can assure you there will never be a dull moment in your life. There is never a boredom or a fatigue in your professional life, and that's something that you need to be very careful about. Because if you are doing something else, you may be doing the same thing again and again every day, and that brings up professional fatigue. But here, every working day will be different because every patient is a new challenge. I'm sure that Dr. Bhuvneshwaran and Dr. Ravi Kumar will agree that there are no 2 patients alike, and this will keep your working day very, very interesting. Reason number 5, you have the ability to work with the latest technology and cutting edge science when you are in medicine. Now, I wanted to actually think about becoming an engineer, but having become a doctor, I don't miss it at all, because every day my work is associated with the latest in technology and cutting edge science. We are looking at very complicated diagnostic machines, which are not only looking at the structure of the brain. Now we are even able to see the molecular changes when you have a different thought process or different parts of the body is acting, what is called the functional MRI of the brain. Every single structure in the body, the spine, every single organ, every single tissue can be seen beautifully in 3 dimensions. And you can also look at the tissues in a molecular way. And working at this kind of scientific atmosphere, now this is what is a modern operating theater. You can see that the gadgets here are everything. image processors, navigation, robotics, and all these can keep you really excited. And in some of the fields like orthopedics, when you are operating every day, not just being helped with other humans, but also you have the sophisticated scanning machines working with you as you operate. You have the most dynamic robots, you have the most dynamic navigation machines, and all these actually keeps you very, very excited, and that is one of the reasons. So, as the leader of the team, where there is a lot of other technical people and scientific people working with you, you have a very nice reason to feel happy about your work. Reason number 6, you have the capacity to help others in an incredibly significant way. You can touch the life of people. You can change the life of a person for good. And when you finish that, at the end of the day, when you create such wonderful changes in a person's life, not just in their physique, not just in their physiology or ability, but in their psyche and psychology. And you can wake up every day knowing that you have a chance to save a life. And you can go to bed every day knowing that you have made a difference in someone's life. And this is very, very important. Even if you have large injuries like this, people say that, is it worth working for such a long time? And in the introduction, Mrs. Kannan also told that many have asked this question, is it worth working such a long time? But when a patient comes to you like this, and it is in your capacity to give back the life to this patient, so that this child will be like anybody else, will have a normal educational life, can get married as normal and live a normal life. That will make you immensely proud. Even when the hands are fully cut, we just don't allow amputation. But now modern technology, microsurgery, reconstructive work helps them to put better. These things actually, you can see concrete results by which you have changed a person's life from the birth to the elderly. Gross congenital defects like this, left untreated, they are completely crippling. But when you treat, you can see that this child is not only cosmetically normal, but also completely normal. And these are the things that you make not just this child, but the whole family, the whole society. And that's a very important even that you have to do. And the other extreme of the society, people like this who are chronically disabled by arthritis, you can see what a change you can do after a joint replacement surgery. So you have the power to make even elderly people live young as they grow old, and also the power to make independent and overcome dependence. You can see that this patient, it was a struggle for him to go even to the toilet. And now you can see that after surgery, this is the kind of improvement that you can hope to have for these patients. And that is very important. And these will make you completely happy. Lastly, being the doctor in your family can make you immensely valuable to your family and friends. You can actually help them quite a lot. But I know that there are two sides to every coin. So when you take a decision of becoming a doctor, you have to be ready for a hard and long academic career. And many of you may struggle academically for the first time in your life. And I want you to be cognizant of this fact, because I have seen many people struggle after joining medical. Most of the people who join medicine are the cream of the student community. I mean, you have to be at the top level to enter into medicine. And you have been used to being the number 1 or 2 in your class. But then after you join medicine, you will find that you are amongst a lot of excellent people and you may be average. Training is intensive and continuous. The working hours are very long. And these are not just while you study, but also when you are as a junior doctor. And you need to make these sacrifices on behalf of your family. And there is a chance that there is a physical and professional life fatigue. So constantly there is stress, burnout, and lack of work-life balance for a doctor. But I will tell you, IT people, people in business, people doing many other jobs, they are under much more stress than what a doctor is, because the doctor gets more more valuable feedback this. So medicine may be a challenge to your mental strength, because not every patient whom you are going to treat is going to be a success. And when things go wrong, or when patients die, as they would because of serious diseases, it can lead to an emotional strain. COVID pandemic was a perfect example. And so this has brought to this question, because are you putting yourself into danger when you do this? Your mental health can be stressed often, but you need to know that you have a duty. When you are in the army, you cannot say, I will not fight war. When you are a doctor, you have to be in the fullness of things. And if you take proper precautions, you do not need to suffer more than what a general public does. You can look at hard work in different ways. You either live one Snoopy, but Snoopy says, no, we live every day, but we die only once. So to conclude, when all is said and done, medicine still allows you to make that difference in somebody's life. And there is nothing more precious than the gift of life. And to see a heart begin to beat again, to see a crippled person walk again, or a patient in pain to smile again can be immensely satisfying. So we are not God to create life, but we can save one, which is the next best thing. And as a doctor, you will have a chance to do exactly that. Before I close, I would like to say some words for the parents of aspiring medicos also. I think if you ask the question, apart from students who are in stress for entering medicine, who is more stressed, I can easily say it is the parents of aspiring medicos. So you have to be an excellent mother hen for your children. You have to share that stress. You have to support them. And you have to be a firm stock on which they can lean upon. And I know the stress and strain of this because I have been a medico. I know what I put my parents to stress. And my children are doctors. And so I know what we went through when they were all applying. So a big good luck to all of you parents also. And my wish is that all of you should come out of this challenging pandemic as champions. So thank you very much for all of you. And once again, I thank Hindu for giving us this golden opportunity to be with all of you. Thank you very much.
Thank you so much, Dr. Rajsekharan. For a minute there, you had me wondering whether I should take up medicine now. Very inspiring, on the edge of philosophy and science and medicine. Thank you so much. We'll now call Dr. Bhuvaneshwaran for his presentation. Welcome, Doctor.
Thank you.
Vanakkam. First of all, I thank Hindu for giving me this opportunity to share some of my views on this particular webinar where we discuss about the status of medical education in the pandemic times. நான் ஆங்கிலமும் தமிழும் கலந்து பேசணும்னு விரும்புகிறேன். எந்த ஒரு ஸ்லைட் ப்ரெசன்டேஷன் என்னட்ட நான் கொண்டு வரல. முக்கியமா நான் சில விஷயங்கள் உங்ககிட்ட பகிர்ந்துக்க விரும்புகிறேன். இந்த மீட்டிங்ல குழந்தைகளும் குழந்தைகளுடைய பெற்றோர்களும் கலந்துக்கிட்டு இருப்பாங்கன்னு நினைக்கிறேன். மருத்துவக் கல்லூரி படிக்கிற குழந்தைகள் மாத்திரம், மருத்துவக் கல்லூரி படிக்க விரும்புகின்ற குழந்தைகள் மாத்திரம் அல்லாமல் மற்ற பல குழந்தைகள் +2 முடிச்சுட்டு ஏன் 10வது 9வது படிச்சவங்க கூட இது மேற்கொண்டு நம்ம எப்படி என்ன படிக்கலாம் அப்படிங்கிற ஒரு ஆர்வம், அந்த மாதிரி இருக்கக்கூடிய இந்த ஆர்வமானது இந்த பேண்டமிக் டைம்ஸ், அதாவது சர்வதேச பரவல், இந்த கொரோனாவினுடைய தொற்று சர்வதேச பரவல்ல இருக்கும் பொழுது நாம் அதை எப்படி அதை எதிர்கொள்ள வேண்டும், இப்போ தற்போது மருத்துவக் கல்லூரி மாதிரி படிப்புகள் எடுக்கலாமா, அதனால நமக்கு இப்போ என்ன ஆயிட்டு இருக்கு அப்படிங்கிறது தான் இப்போ ஒரு முக்கியமான கேள்வி எல்லார் மனதிலும். முக்கியமா நான் ஒன்று சொல்லிக்க விரும்புறது என்னன்னா, இப்போ என்ன ஒரு சின்ன உதாரணமாக எடுத்துக்கிறேன். நான் ஒரு கிராமப்புறத்தை சேர்ந்தவன். அந்த ஒரு கோபிச்செட்டிப்பாளையம்ன்ற ஒரு சின்ன ஒரு ஊர். அந்த ஊர்ல இருந்து தமிழ் மீடியத்தில் தான் நாங்கெல்லாம் படித்தோம். படிச்சுட்டு மருத்துவக் கல்லூரியில சேரும் பொழுது எனக்கு இப்பவுமே ஞாபகம் இருக்கு, ஒரு 2-3 வார்த்தைகள் கூட ஆங்கிலத்துல பேசுறதுக்கு, இங்கிலீஷ்ல பேசுறதுக்கு ரொம்ப தயக்கமாக இருக்கும். அதிலிருந்து நாங்கள் பல வருடங்கள் கடந்து பல சோதனைகளையும் பல விஷயங்களையும் கடந்து தற்போது இந்த ஒரு நிலைமைக்கு வந்திருக்கோம். அப்படிங்கிறது வந்து நான் எதற்காக சொல்ல வரேன் அப்படின்னா, இந்த மாதிரி ஒரு இங்க பலரும் நீங்க கிராமத்தை சார்ந்தவர்கள் வந்து சில பேருக்கு அந்த ஒரு எப்பவுமே ஒரு மனசுல அந்த ஒரு பயம் இருக்கும். நாம வந்து ஆங்கில கல்லூரி இதுல படிக்கல, இங்கிலீஷ் மீடியத்துல படிக்கல, தமிழ் மீடியத்தில் தான் படிச்சிருக்கோம். நம்ம கிராமத்தை சார்ந்தவர்கள், நம்மளால இந்த மாதிரி ஒரு மருத்துவக் கல்லூரிலாம் போய் நம்ம அதுல வெற்றி கொள்ள முடியுமா அப்படிங்கிற ஒரு பயம் இருக்கும். கண்டிப்பாக அந்த பயமோ அந்த ஒரு தயக்கமோ வேண்டாம் அப்படிங்கிறது என்னுடைய முதல் விஷயமா நான் உங்களுக்கு சொல்ல விரும்புறது. இப்போ எடுத்துட்டீங்கன்னா ஒரு +2 படிச்சதுக்கு பிறகு உங்களுக்கு வந்து சயின்ஸ் குரூப் எடுத்தவங்களுக்கு மருத்துவக் கல்லூரி மாத்திரம் அல்லாமல் பலவிதமான விஷயங்கள் உங்களுக்கு படிக்கிறதுக்கு வாய்ப்பு இருக்கு. அது உங்களுக்கே தெரிஞ்சிருக்கும். ராஜசேகர் சார் கூட சொன்னாரு. இப்போ முன்னால் நாங்கெல்லாம் பாஸ் பண்ண பொழுது ஒரு 2-3 ஆப்ஷன்ஸ் தான் இருந்தது. ஆனா இப்ப பாத்தீங்கன்னா உங்களுக்கு பலவிதமான விஷயங்கள், நீங்க வந்து வெட்டினரி சயின்ஸ் படிக்கலாம், நீங்க வந்து அக்ரிகல்ச்சர் சயின்ஸ் படிக்கலாம், இன்ஜினியரிங் சயின்ஸ் அண்ட் மேத்ஸ் காம்பினேஷனா வரதுனால இன்ஜினியரிங் எடுத்து படிக்கலாம். இந்த மாதிரி பலவிதமான ஆப்ஷன்ஸ் உங்களுக்கு வருது. இல்ல இன்னும் முக்கியமான ஒரு விஷயம் பாத்தீங்கன்னா, நாங்கெல்லாம் படிச்ச போது எங்களுடைய செலக்ஷன் ப்ராசஸ் என்று சொல்லக்கூடிய தேர்ந்தெடுக்கப்படும் முறையானது இன்டர்வியூ பேஸ்ட், அதாவது ஒரு நேர்காணல் மூலம் அப்படிங்கிற மாதிரி இருந்து, பிறகுதான் வந்து இந்த என்ட்ரன்ஸ் எக்ஸாம் அல்லது நுழைவுத் தேர்வு அப்படிங்கிற அது இதுவே வந்து நாங்கள்லாம் வந்து மருத்துவக் கல்லூரியில சேர்ந்து அந்த சமயத்தில் தான் அது வர ஆரம்பிச்சது. தற்போது உங்களை எல்லாத்துக்கும் தெரியும், இப்போ வேறு விதமான நுழைவுத் தேர்வு அது தேசிய அளவில் நடைபெற்று கொண்டு அதன் மூலமாக தற்போது சேர்த்தல் நடந்து கொண்டிருக்கிறது. இப்போ இந்த கோவிட் டைம்ஸ் அப்படிங்கும்போது ஏன் அதுல என்ன ஒரு வித்தியாசம் அப்படின்னா, தற்போது இந்த கொரோனாவுடைய காரணத்தினால பல தேர்வுகள், அது பள்ளி தேர்வுகளாக இருக்கட்டும், கல்லூரி தேர்வுகளாக இருக்கட்டும், அதுக்கு மேலேயா அந்த மாதிரி எல்லாமே வந்து தற்போது ஒரு நேருக்கு நேர் ஒருவர் அதை நேராக எதிர்கொள்ளாமல் முக்கியமாகவே எல்லாமே வர்ச்சுவல் மோட்னு சொல்லக்கூடிய ஒரு நேராக இல்லாமல் அது நெட் மூலமாகவோ ஆன்லைன் மூலமாகவோ வீடியோ மூலமாகவோ இதன் மாதிரி மூலமாகத்தான் தற்போது ஒரு கற்பித்தலும் அதுக்கு அதுல பரிசோதனை
Sorry, Dr. Bhuvaneswaran, there are some requests if you can also address in English in the Q&A. So I just wanted to convey that to you.
Fine. So there are the whole methods of the teaching, the interviewing, the education, everything seem to be happening more now through online. Now, இது வந்து ஒரு முக்கியமாக is one of the very important things which have happened in this pandemic, that even the exam process, the selection process, most of the things are now happening through. Now, the second one is many parents or even students are worried, should we take up medicine now? Because if we see here, when everything has stopped, the only active profession which has never stopped are the medical and the supportive things. Appo, is it worth it? Is it worth putting our children into medicine? Or the students think that is it worth that should I take up medicine? And அந்த மாதிரி ஒரு கேள்விக்கு டாக்டர் ராஜசேகர் ரொம்ப அழகான ஒரு பதில ஆல்ரெடி கொடுத்துட்டார். அதாவது எத்தனை வாட்எவர் ஹேப்பன்ஸ், எத்தனை விதமான படிப்புகள் பின்னால வந்தாலும் மருத்துவக் கல்லூரி அல்லது மருத்துவம் சார்ந்த படிப்புகள் அப்படிங்கிறது வந்து இட் இஸ் சம்திங் வெரி டிஃப்ரெண்ட். அண்ட் அது வந்து நமக்கு கண்டிப்பாக ஒரு மிக மிக முக்கியமான ஒரு 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 தொடக்கம், ஒரு வெரி குட் ஓப்பனிங், பிகாஸ் திஸ் இஸ் த ஒன்லி ப்ரொஃபஷன் வேர் யூ கேன் டெஃபினெட்லி மேக் அ டிஃபரன்ஸ் இன் சம்ஒன் எல்சஸ் லைஃப். ஒருவருடைய வாழ்க்கையில் நாம வந்து ஒரு வித்தியாசத்தை உண்டு பண்ண முடியும் அப்படிங்கிறது வந்து இந்த மருத்துவக் கல்லூரியில் அல்லது மருத்துவ படிப்புகளில் நமக்கு இருக்கு அப்படிங்கிறத நம்ம தெரிஞ்சுக்கணும். இப்போ இந்த சில வார்த்தைகள் இப்ப நமக்கு தெரியும், உங்களுக்கு இந்த பேண்டமிக் அப்படிங்கிற சமயத்துல என்ன விதமான விஷயங்கள் அப்படின்னு பாத்தீங்கன்னா, என்னை பொறுத்தளவுக்கு வந்து இது ஒரு போர்க்களம்னே சொல்லலாம். இட்ஸ் லைக் அ வார் ஃபீல்ட் வேர் த ஃப்ரண்ட் லைன் ஒர்க்கர்ஸ் ஆர் the medical people, the nursing people, the sanitary people, even now the police people, the people who help to keep the sanitization intact, இவங்க தான் வந்து they are making a very big impact and difference in the society. In fact, of late, especially in the pandemic times, as a doctor, somehow I have been always feeling so happy, so positive, primarily because when everybody else have been thinking like what to do, how to pass our time, we as a professionals, as a medical people, எங்களுக்கு வந்து பார்த்தீங்கன்னா தொடர்ந்து நேரடியாகவோ அல்லது டைரக்ட்லி ஆர் இன்டைரக்ட்லி we have been so well involved in serving the people, serving the society and doing the best possible. அப்புறம் நீங்க இப்போ பல விஷயங்கள் இப்போ நடந்துட்டு இருக்கு. அதுல பாத்தீங்கன்னா ஒரு மெடிக்கல் எஜுகேஷன்லயே you should know that after when we studied it was totally different, and what is going to happen பின்னால வந்து இப்போ தற்போது மெடிக்கல் எஜுகேஷன் எந்த மாதிரி நடந்துட்டு இருக்கு அப்படின்னு பார்க்கும் பொழுது now I really want to tell that புதிய முறைகள், there are much newer methods of teaching வந்திருக்கு. முன்னாடிலாம் பார்த்தீங்கன்னா usually we do a theory exam, we do a practical exam and oral என்று சொல்லக்கூடிய நேர்காணல், அதாவது கேள்வி பதில், இந்த மாதிரி அதன் மூலமாக ஒரு மருத்துவனானவன் பாஸ் அல்லது ஃபெயில், அது பாஸ் ஆனதுக்கு பிறகு பயிற்சி மருத்துவம் அல்லது ட்ரைனிங் இப்படி இருந்தது. தற்போது we call it as a competency based. டாக்டர் ரவி குமார் எனக்கு பின்னால பேசக்கூடிய அவர் வந்து அதை பத்தி உங்களுக்கு இன்னும் ஒரு விலாவாரியாக அல்லது எலாபரேட்டா அதை பத்தி சொல்லுவாரு. தற்போது ஒரு முக்கியமான விஷயம் இப்போ மருத்துவக் கல்லூரி எடுக்க விரும்பும் மாணவர்களுக்கும் மாணவிகளுக்கும் நான் சொல்வது என்னவென்றால், தற்போது மருத்துவக் கல்லூரியின் அணுகுமுறையிலேயே பல வித்தியாசங்கள் வந்திருக்கு. So many new things have come. The most important word what we call this as competency based medical education. அதாவது உங்களுடைய திறமையை பொறுத்து, அதாவது நீங்கள் ஒரு becoming a doctor, it's not just you are proficient in the theory. You are proficient in the theory as well as you are proficiently in serving and doing your duty as a doctor perfectly. அப்போ ஃபார் எக்ஸாம்பிள் இப்போ வந்து பிளட் ப்ரெஷர், ரத்த கொதிப்பு அப்படின்னா என்ன அப்படிங்கிறது தியரியில் நமக்கு சொல்லிக் கொடுப்பாங்க, பிபி அப்படிங்கிறத பத்தி, பிளட் ப்ரெஷர் பத்தி. Whereas in a competency based, it is not just a question of educating you on blood pressure, but they will tell you how to take a blood pressure and how you do a blood pressure and how you interpret a blood pressure. So அப்போ முன்னால வந்து ஒரு மெடிக்கல் மருத்துவக் கல்லூரி மாணவன் வந்து ஒரு 3வது வருடம் படிக்கும் பொழுதுதான் வந்து மருத்துவ கல்லூரி மருத்துவமனைக்கு ஆஸ்பத்திரிக்கு உள்ள போறதே அந்த சமயத்துல தான் இருப்பாங்க. ஆனால் இப்போ இந்த புதிய முறையில் உங்களுக்கு என்னன்னா ஒரு மிக அற்புதமான ஒரு விஷயம் என்னன்னா, ஃப்ரம் த ஃபர்ஸ்ட் இயர், முதல் வருஷத்துல இருந்தே நீங்க உள்ள போய் அதன் மூலம் நல்லா கத்துக்கிறதுக்கு வாய்ப்பு இருக்கு. அதனால தற்போது ஒரு முக்கியமான உங்களுக்கு ஒரு விஷயம் என்ன சொல்லிக்கிறேன் அப்படின்னா, the monotony of medical education அப்படிங்கிற மாதிரி முன்னால் சொல்றது போக, now you are a doctor from day one. Although you are becoming a doctor after 5.5 years of qualification, 5.5 years of hard hours, but you should know that you are a doctor from day one, because அந்த வெள்ளை கோட்டை போட்டுட்டு ஒரு மாணவனோ மாணவியோ ஒரு மருத்துவக் கல்லூரி மருத்துவமனைக்குள்ளேயோ அங்க போகும் பொழுது நோயாளிகள் வந்து டாக்டர், சின்ன டாக்டர்னு சொல்லுவாங்க அந்த மாதிரி. ஸோ தட் வே இட் இஸ் எக்ஸ்ட்ரீம்லி இம்பார்ட்டன்ட் ஃபார் யூ டு அண்டர்ஸ்டாண்ட். There's a lot of exciting things awaiting you if you take up the medical education currently. And interesting இன்னொன்று என்ன நடந்துட்டு இருக்குன்னா, now all our classes, most of our medical education classes are also going online. இப்போ வந்து ஹாஸ்பிட்டல்ல இப்போ பார்த்தீங்கன்னா மோஸ்ட்லி பயிற்சி மருத்துவர்கள்னு சொல்லக்கூடிய the CRRIs or the house surgeons சொல்லுவோம், 5 வருடங்கள் படித்தது பிறகு அந்த பயிற்சி மருத்துவர்கள் தான் இப்போ இருக்காங்க. மருத்துவக் கல்லூரி மாணவர்கள் அப்படிங்கிறவங்க இப்போ ஹாஸ்பிட்டலே இல்லை. இது எல்லாமே primarily because of this pandemic. அப்போ இந்த பேண்டமிக் அப்படிங்கிறது வந்து பலவிதமான விஷயங்கள் நமக்கு நம்ம மேல சுமர்த்தி இருக்கு. ஒன்று, நம்முடைய இந்த பரீட்சைகளை அணுகுமுறை, நாம் தேர்ச்சி பெறும் முறை, தற்போது எந்த இதை எடுத்து படிக்கலாம் அப்படிங்கிறதுல நமக்கு சில சேலஞ்சஸ் இருக்கு. இவ்வளவு இருந்தாலும் இந்த மருத்துவக் கல்லூரி அல்லது மருத்துவ கல்வியை பொறுத்த அளவுக்கு நமக்கு இட்ஸ் பீன் ஆல்வேஸ் a blessing that you have an option. இன்னொன்று பொதுவாக நம்ம எல்லோரும் என்னன்னா ஏன் ஒருவர் மருத்துவனாக ஆக வேண்டும் அப்படிங்கிறது வந்து we ask this question. In fact, as a professor, I ask this question to all my students whenever I meet up with students. Why do you want to become a doctor? அதில் பல பேர் வந்து சார் எங்கள் அப்பா அம்மா my parents wanted me to become a doctor. அப்படித்தான் மெயினாக நிறைய பேர் சொல்ல ஆரம்பிப்பாங்க. அப்புறம் சில குழந்தைகள் they may say that sir, I want to take up medicine because I want to serve the society and public. So then there are some smart children who say that it's not only it's serving the society and public. I get a special status in the society. In that way, medical field gives you still that status and an excellent chance to do service, and it gives you prosperity. But most important, I always say, that is a dharmam. That is something very dharmic in the whole medical education. In fact, if you see, நம்ம பாரம்பரியமா பார்த்தீங்கன்னா ப்ரொஃபஷனலி பாரம்பரியமாக ஒரு 3 விஷயங்கள், அதாவது ஒரு எஜுகேஷன் என்று சொல்லக்கூடிய படிப்பு, மருத்துவம் என்று சொல்லக்கூடிய இந்த இவையெல்லாம் எப்பவுமே அதே மாதிரி உணவு, இந்த 3மே நம்முடைய பாரம்பரியத்தில் வந்து they have been always given as free. லைக் அது மருத்துவ சேவையாக இருக்கட்டும் அல்லது படிப்பாக இருக்கட்டும் அல்லது உணவு அளிப்பது, அதாவது நம்ம ஒருத்தருக்கு சாப்பாடு கொடுக்கறது, இது எல்லாமே they have been always been sort of free. But down the time இப்போ பார்த்தீங்க அப்படின்னா it has now become, these 3 industries have become very major commercial industries. In spite of all that, there is something very special about medical, because the point வந்து Dr. Rajshekhar also touched, that you have an ability to serve and help somebody and make a difference in his life. இது வந்து it is possible only with medical and allied sciences. Whereas, where I always say that when you are able to do something to make a change in patient's life, in fact, even to an extent as a good instrument for him to become alive, அதை விட ஒரு பெரிய ஒரு மனதில் இருக்கிற ஒரு சந்தோஷம், ஒரு அமைதி வேற விஷயங்கள்ல கிடைக்கிறது இல்லை. அதனால எப்பவுமே நான் சொல்ல விரும்புறது என்ன அப்படின்னா, எத்தனை விதமான படிப்புகள் எது இருந்தாலும் மருத்துவக் கல்லூரியினுடைய படிப்புகள், அதை சார்ந்த படிப்புகள் அப்படிங்கிறதுக்கு இருக்கிற மவுசு எப்பொழுதுமே குறைய போறதில்லை. அதனால I wish all of you all the best. And the parents also, you should know that it is not just the end. If somebody gets medicine, somebody gets what they want, it's fine. If they don't get, doesn't mean that the life it's come to an end. I always say, ஒரு கதவு மூடினால் மற்றொரு கதவு திறக்கும். And you should know, இப்போ இந்த சமயங்கள்ல எல்லா குழந்தைகளும் நான் மருத்துவம் படிக்க விரும்புகிறேன், மருத்துவம் கிடைக்கவில்லை என்றால் நான் என்ன செய்ய வேண்டும் அப்படிங்கிறத இந்த எப்பவுமே ஆல்வேஸ் வி கால் பிளான் ஏ பிளான் பி, அதை மனசுல வச்சுக்கணும். பிளஸ் முக்கியமா இன்னொன்னு என்ன சொல்லிக்கொள்ள விரும்புகிறேன்டா, மருத்துவத்துல வந்து அதை சார்ந்த படிப்புகள்னு வருது, நிறைய இருக்கு. லாட் ஆஃப் பேராமெடிக்கல் கோர்சஸ், ஃபார் எக்ஸாம்பிள் இப்போ வந்து cath lab technician கோர்சஸ் இருக்கு, டயாலிசிஸ் டெக்னீஷியன்ஸ் கோர்சஸ் இருக்கு, சிடி டெக்னீஷியன்ஸ், இந்த மாதிரி பலவிதமான படிப்புகளுக்கும் மிக மிக அதிகமான ஒரு தேவை இருக்கு. அதனால டோன்ட் திங்க் தட் ஒன்லி மெடிக்கல் MBBS it makes a difference. There are so many supportive courses, and in fact even if you take nursing, there are so much of come up in nursing. அதாவது ஒரு நர்ஸ்லயே இப்போ நர்ஸ் ஸ்பெஷலிஸ்ட், நர்ஸ் ப்ராக்டிஷனர்ஸ், இந்த மாதிரி ஒரு செவிலியர்கள்லையுமே அவங்களே வந்து ஒரு பலவிதமான விஷயங்கள் செய்யக்கூடிய அளவுக்கு வந்து அதே மாதிரி சார்ந்த மற்ற மருத்துவ படிப்புகள். அதனால ஓவரால் ஐ வாண்ட் டு டெல் யூ, இன் ஸ்பைட் ஆஃப் த பேண்டமிக், ஐ ஆல்வேஸ் ஃபீல் that the demand for the medical education will be very high, and choosing to become a doctor or a allied healthcare personnel is something very special, very unique, that you have a chance and choice to do something in someone else's life. And more than anything, these particular fields, they just don't give you a status and wealth. It gives you a sort of a peace. It gives you a sort of a spiritual enlightenment to serve somebody And that is one of the most important things in life. So children, parents, I wish you all the best. And I thank once again the Hindu group for giving me an opportunity. And I'll be definitely interacting with you in the question and answer session when the questions are directed to me. God bless you and all the best. Thank you.
Thank you so much, Dr. Bhuvaneshwaran, for pointing out the two sides of medicine as it were. We now invite Dr. Ravi Kumar to make his question. Yeah, he's already on.
Good morning, everybody. Is my PowerPoint on the screen?
Yes, sir.
Okay. First of all, thank you very much, Ms. Ramya and the Hindu, for holding this webinar. And I think it's very, very appropriate topic has been chosen. I represent SRM University and the Faculty of Medical and Health Sciences in SRM University. When I say health sciences, it means it's not only medical college, it's also the other specialties connected with medical college, such as nursing, physiotherapy, occupational therapy, dental, pharmacy, etc., etc. So there are 7 colleges there. And we have been doing this for several years. And at the outset, I must say that what is important in this is their whole day when they were trained, how they were trained and how they succeeded in life. You don't need to be a fantastic, brilliant person, but you need a lot of commitment and you need a lot of nurturing and you need to have that will to learn at all times. Whether you're a learner now or when I'm 65 plus, whether I'm still reading, you have to read. That is one of the most important commitments you need. And the commitment to serve the humanity at all times, sacrificing your own personal comforts and your family life. That's the most important motivation that is required, whatever specialty you may take. And that has not changed over the years. That still remains the same. And for that nurturing, you need an excellent place and good teachers to train you. And I still connect to my old teachers who are the ones who made me what I am today. And we always remember them at our institution. This is a bird's eye view of the university, and especially in the foreground, you see the medical facilities. And this is our medical college. We have an excellent infrastructure. We have been blessed with some of the best equipment available in the world and equally good faculty members. It's located a little outside Chennai, in fact, closer to Chengalpattu. And it has got an intake of 150 students to do MBBS every year, which is being upgraded to 250 in this year, provided the National Medical Commission gives us the permission. We also run several courses in other specialties, as I already told you. And we have excellent infrastructure matching anything in the world, including huge lecture theaters with all Wi-Fi and connections. And even now, this is one of the faculty sessions going on, you can see, because we don't have students at the moment, where we can actually practice physical distancing and carry out classes for almost 150 to 200 people in one hall. And with all this infrastructure and an equally good hospital to match, we have almost a 1,500 bed, more than 1,500, 1,550 bed hospital to teach students clinical practice as it is done in all the specialties. And with a faculty strength of about 450 odd doctors and then about 700 nurses, as well as a lot of paramedical and other supporting staff, we are able to function effectively and carry out training of the doctors at the same time. Now, this is also matched by an excellent library facility, Wi-Fi, all the connectivity. Basically, as the speaker before me alluded, you need an environment where you can make a student who comes out from school into a professional. Professional doctor is somebody who has got, this is my quote from the Medical Council of India at that time, now called the National Medical Commission, that he should be a person who is able to have knowledge, practical skill, that is the psychomotor skill, able to have communication skill with the patient, have good behavior, and also be a team leader, because he has to lead a team of the nurses, paramedicals, other staff, and be a lifelong learner, because there is no end to the amount of developments and latest technologies which are coming into this field. I cannot imagine how I survived and practiced 35 years back when I became an ENT surgeon. Because right now, I cannot function without a microscope, without an endoscope. It was not existing. CT scan was not existing at that time. And so you have to learn, adapt, and improve all the time. So that attitude of, I said, the motivation to be a service-oriented person, to accept a team and lead a team, to communicate and have the best behavior in front of the patient, and also be a learner. I learned many things from the nurses. I learned many things from my paramedical workers, my speech therapist, audiologist, because you have to have that attitude. Otherwise, it will be a one-way traffic and we will not progress. Now, this is how things were going on till something occurred last year. The pandemic suddenly landed on us, and then it caused sudden disruption. In history, whenever such things happen, they cause profound changes. We know of the world wars and what changes they produced. We know of the Spanish flu pandemic. We know of the SARS virus, but that was nowhere compared to what happened in February last year and March in India. It changed our lifestyle, confined families to their homes, and schools and colleges, most importantly. One of the biggest losses has been on the student community. They just shut the schools and colleges. And then what happened? The medical college is the only exception because we are needed, including the interns who are working in the hospitals. We functioned intermittently. Whenever the government relaxed the norms a little bit, we got our students back into the college, because this is a training which is not only academic, not only knowledge based. You have to have that interaction with patients. You have to have interaction and practice the skills needed to become a good doctor. So all the institutions, including medical college, started online education. We had already started on this process about a few months, 6 months before this actually happened. We had installed what is known as a learning management system, through which we were sending all the content of the lectures in advance to the students. And they had to prepare it at home, come back for discussions in the classroom, so that the classroom becomes an interactive platform to learn and teach. Otherwise, as my previous speakers had told you, 35 years ago, we were all just listening to lectures and lectures and lectures. Unfortunately, that still happens online. It should not. It should be a discussion, interactive, because technology has empowered us to do that. What we are doing right now is because we have got technology to discuss. You are sending your questions by chat box. We are answering it. So we are multitasking. We are learning all the time. You're completely involved, both the learner and the teacher. That is the type of change which I thought has brought about by this virus. The students, teachers, and the parents, of course, were forced to change. But already the education institutions had invested a lot of their capital on hardware, but they had to also invest on online licenses like what we're having now, the Zoom license, and also all the other expenses connected with conducting online classes. And the downside, unfortunate downside, which should not have happened, but it happened, is the digital divide. The haves and the have-nots. What is the have? The ones who have the internet connection and smartphones and laptops. Have-nots, unfortunately, were left out. This is true of a country like India, where we have a varied population with different socioeconomic groups, and those who did not have access were really the ones who had suffered. So we have to find an answer to that by getting them on. Because for a country to progress, education, health is extremely important, and they are the two very important parts of the backbone on which the country develops. And India is a country with a young population. 40% is under the age of 25. And so we need that education should not have stopped. Education should have continued in whatever form, and we should have enabled these people without access to internet to get the internet as soon as possible. So initially, the children were happy because they didn't have to go to the college or school. So they were euphoric. And soon they became bored with the classes. They found ways to avoid the classes or mark the attendance and walk off. But right now, my reading is that they are in a depressed mood. They don't know what's going to happen, especially the ones who are listening now, the ones who have done the 10th, 11th, 12th, because they have to have a roadmap for the future. But don't despair, because every time the change happens, the disruption happens, we find new solutions. That's the way mankind has evolved. When we did not have a way to go to the moon, we found a way. Similarly, we will find a way to overcome this pandemic and progress on. Professional education actually was handicapped in online mode because we were more practical oriented, and we should have had much more exposure to patients, their operations, investigations, diagnosing, interacting, all those things. So what is the remedy? You have to fix the problem and find a solution. And in this case, technology was the solution according to what we thought. We resorted to hybrid learning, which we had already started. We had already used what is known as a medical simulation methodology for practical training. Earlier on, we were giving it only on the campus, but we had to find a way to do it, demonstrate it, and then transmit it to the internet for the students to watch and then comment and discuss online. And then whenever we had the opportunity to get the students back on campus, which happened 3-4 times, while adhering to the COVID appropriate behavior, that is, we had to get them in small batches, we had to make them do it in a large hall, and we made them practice and demonstrate. That is the assessment which we could do in those small windows of period when the pandemic related lockdown was relaxed. But one thing we did, we got the feedback from every batch of students who were trained, because as I told you, we are also doctors, we are also lifelong learners, and we learn a lot from the students' comments. So don't be hesitant to give a good feedback. This is an example of how online classes used to be held. Each teacher had this screen in front of him and they had to monitor, ask questions. It was interactive. We are blessed in our institution with one of the finest simulation centers, which was established way back in 2011 with help from the Brigham and Women's Hospital in Boston, which is affiliated with Harvard Medical School. And this was put into full use during the pandemic, because this is some of the pictures we have before the pandemic, how we have mannequins simulators. Now the difference is the simulator, actually the one at the bottom right hand side of your screen, and we see like a human being who is lying down and somebody is performing a task on that simulator. They will respond. If you press too hard, the simulator will respond saying it's painful. So that you get the feedback, tactile feedback. So that's the difference. We were doing all this before the pandemic. Now, we also have so many things for the students to learn, like basic life support, advanced cardiac life support. This training is given regularly. All this required the students to come there and practice. This was getting missed out during the pandemic and lockdown. So we had to change our ways of doing things. These are some of the examples of how students were practicing, not only medical, paramedical also. Then we came to a situation when we had to change over to a pandemic situation. So we had to get our postgraduates and people who are actually in our hospital to perform these tasks and then demonstrate it online, conduct a test, and then try to make the students understand and explain, and also conduct some tests so that we know that they actually imbibe. So that is adaptation. In the center, you see a lady doctor. She is the head of the simulation center. She is performing, and it is being zoomed into the students all over the Tamil Nadu, elsewhere, wherever they're connected by internet. And then they are asked questions and answers. We give Google Forms, etc. to answer. Here again, demonstration is happening of various techniques, including donning, how to wear that suit, PPE suit. All that is done online. So that some practical training does take place. But I must confess, it is not the same as what would happen in real classroom or a real simulation center in the campus, because we cannot correct the small mistake they might be doing. So what did we do? When we got them back into the campus for those brief breaks, we completely avoided, or we completely made the theory classes minimal. Instead, resorted to intensive practical training. Because the patients were not there in the normal OPD, we had to resort to the simulation center. But whenever patients were there, we could demonstrate on patients also. So this is the type of measures we did. And then we have, as I told you, majority of these classes were done to the medical college. We also had classes for the dental, nursing, physiotherapy, etc., including nurses who were working in the hospital. So that's how we did not stop our practical training. And what did we get as a feedback? Most of the students and some of the CRRA is the interns, they're very satisfied with what we are doing online. The feedback has been positive so far. So whether you like it or not, we have to continue to practice this neuroeducation till this pandemic is over. So this is the adaptation we made. In addition, to teach them behavioral skills as well as communication skills, we have special classes in which these are also taught with interactive training. Here is a little feedback. Most of them were happy with the simulation-based hands-on training. And then especially we were happy with the CRRIs who are the ones who are going to become doctors after they finish their mandatory 12-month training. And they were asked questions like this, and most of them were happy with the training. We have to practice when they come back to our institution all the precautions. Campus classes will still be held with all the norms as prescribed in COVID. This is displayed everywhere, and they have to practice. Unless the doctors and the would-be doctors practice this, we cannot expect our patients or the relatives to observe this. Entry to all the buildings, including the college and medical facilities, hospitals, is through a thermal imaging so that anybody with fever is caught there. This way, we like to protect our children from getting infected. Now, almost all the students who are coming back for classes are expected to get vaccinated. We will assist them, or they are given free vaccination so that they do not have any doubts about the pandemic getting into, catching the infection. And we don't directly ask them to go near the patient when we have practical classes in the hospital. As my previous speaker said, the new curriculum actually enables students to come into the hospital within 1 month after joining medicine. That is called the competency-based medical education, which is responsible for not only teaching medicine academically in theoretical knowledge, psychomotor skills, which also we learned, that is the skills to perform certain tests or examine the patient. But what was lacking in the previous type of curriculum, which we all learned by observation of our seniors, is now being formalized. That is, we have to teach the student how to address and how to behave in front of the patient and how to communicate with the patient respectfully at all. And these are the two other skills which are taught, assessed, and they are given marks for it separately. So to do these two things extra, we have to get them back into the medical college. So my request to the parents of aspiring medical students is, do not despair to send your children to medical college, because we are aware of the dangers of this virus and we are taking all the precautions. We will make sure that the children are protected. And this is the proof of the pudding. We have not had any serious infection in our medical college or hospital of a medical student or nurse who has had severe infection or any mortality so far. And I have actually a few slides on this, but I think I'll leave it for you to ask questions. We have had this act passed in 2019 under which the admissions to medical colleges are controlled centrally. There are some questions in the chat box about how do I get into medicine? Is there any other test other than NEET? So far, nothing. And NEET has only been postponed. It has not been cancelled. So NEET will happen when we do not know. And the act in the NMC Act of 2019 actually gives you that certain institutions are holding a separate exam after the NEET. It is not in lieu of NEET. And this is also a slide which I put up earlier on. The demand for medical education is going up because, as my previous speaker said, as long as the population is growing, as long as humankind is there, disease is there, we have a job. It's a question of how well you do that job. And seats availability has steadily increased with all the new medical colleges and AIIMS being set up. But there's a big gap even now. India needs a lot of basic doctors, and India needs them in all over the country, not just in the cities. And we find that the gap is still there in spite of so many medical colleges being available. The figures speak for themselves. And the counseling is there, and we have some quotas. These are all things which I think most of you would be knowing. But just to emphasize that last year, the Tamil Nadu government got a special quota of 7.5% for people from Tamil Nadu. And we find that if you have too many, this is my opinion, too many reservations, then you dilute the quality. Because you and I, if we fall sick, God forbid, we expect the best possible treatment at the worst possible time, meaning at 3 a.m. in the morning. When we go to the casualty, we want the doctor to be extremely smart, well-behaved, also perform everything perfectly. If you want that sort of quality, we have to have a quality person with motivation and good training to come into this field. That is a challenge. So we have to address these issues. So if you are motivated, please do take up this course, and depending on your ranking and the institution, I'm sure that with hard work, you will shine brighter than the stars if you perform it all the time and have that attitude of learning all the time. With this, I thank all of you, especially the Hindu and other sponsors, for having lent their ears for the last 15-20 minutes. And thank you very much, and all the best for your selection.
Thank you very much, Dr. Ravi Kumar, for that extensive and exhaustive presentation. All of you have been answering the questions online, I see. So I'm just going to pick up some common questions that might require answers for the entire audience. One, of course, you've just addressed, but other subsidiaries to that is the questions on NEET as an entrance test this year. And what is the entrance test for private private medical colleges? And will 10th marks be taken, 10th and 12th marks be taken if not for NEET? Dr. Ravi Kumar, maybe you want to start.
The question is, what is the methodology this year? Is there going to be the 10th and 11th marks taken for selection of medical students? As I already told you, the NEET exam is not being cancelled. So that will be the yardstick as of now. It's been postponed. So whenever it happens, what parameters will be used? Till now, they were only using the marks they need for selection. So that's where it stands at the moment. Whether any modifications may take place, it depends on what the government and the officials, of course, the public will be consulted. Because it's a peculiar year, we had very less amount of almost nil school education in the schools. It was mostly online, and they have cancelled the 12th exam. So there is a committee which is working on how to assess the students and grade them. So there has to be some selection examination. In my opinion, it is going to be the NEET examination. When is the question?
Right, thank you. There's another question on whether coaching is necessary for NEET at all, in your opinion.
Yes, and maybe a weak no, because it's a highly competitive examination. And I told you the demand and the availability of seats. So a lot of aspirants feel very frustrated that they're not able to make it. It's not the toughness of the exam, it's the technique of answering the questions, I suppose, which is what the coaching classes teach you. How to manage your time during the examination, how to look at the question and sort of understand what it wants you to say. Like problem solving questions are there. It's not just multiple choice questions. So we have to have the technique. So maybe just sharpen the skill and enhance your skill of taking the examination and getting a positive result. It will help to have a coaching class. But you cannot take the coaching class as a substitute for learning yourself. Basically, you have to learn your subject well. They'll only fine-tune you for the examination. I'm sure my colleagues will agree on this.
Yeah, definitely, sir. I agree with you because one is knowledge, the other is cracking the technique of the examination. Because different formats of exams have different technique in which you have to be successful. Sometimes in the school, we have found that if suddenly the question paper is changed from essay questions to short questions, students have a problem. Like that, MCQ question has a set of rules and set of abilities to crack through. So I think a formal, you should read well. Dr. Ravi Kumar exactly said, no compensation for knowledge. After reading well, to be successful in the exam, I think they should go through a coaching.
Yes, actually, but only thing is you may have to be very choosy in selecting the type of coaching classes. The more important is you have an idea about what you are going to do in the exam. That is the most important. As you say, it's not only the MCQs, the problem solving questions, etc. So you will have an exposure of various modalities of questions, and you will be familiar with the exam. Now, that is one important thing when you will be more confident to face the exam.
Right. Yes, that makes sense. I hope that's answered some of your questions. There's one interesting question on the impact of pandemic on medical education in a positive sense, on medicine itself in a positive sense. Dr. Rajshekhar, do you want to take that question?
Yeah. So I would say that there are a few positive things on this pandemic. Number one, when the society and the younger generation were getting carried away into newer avenues of professions like finance management, data analysis, artificial intelligence, and all these very attractive. I think they are all very important too. But the pandemic really just taught us how important life itself is. I mean, it really gave a big dignity to the medical profession. It refocused on more important things than sophistication and advances and brought us to the basic fact you have to be healthy to enjoy anything else that is available in the world. People started thinking of medical profession as the most important profession, and any of the family members who have had a COVID positive patient inside them, they would know the agony, anxiety, and things they underwent till the patient came back from the hospital to the. So that is one. The medical profession got a status and a respectability. Second is it also gave a lot of recognition amongst the public for doctors. The doctor-patient relationship was undergoing a lot of imbalances over the last few years. So this has, in a large method, be rectified. One of the questions in the chat box I saw was one father has written, I'm really worried. My daughter is in medicine, and when I see on the television that doctors are getting beaten. He had mentioned it as a question. I also answered to him. I think, these are very, very, very stray incidences. It is just like you go on the road, you can get an accident. So none of us stop going into the car because there is an accident reported on this. Aggression towards doctors in times of distress is known from time immemorial, but it's extremely rare. But now the WhatsApp, Facebook, and other things are highlighting it to such a degree that it looks as if it is common. All of us have practiced, all the panel members have practiced for more than 3 decades or nearly 3 decades. We would know that still, when you are true to the patient holds you with so much respect. I don't think this is a problem at
all. If I can
add. Yes, please.
No, actually, the pandemic has taught us that we have to be very respectful to each other, because we find that a lot of, as what Dr. Rajshekhar was saying, there was a major problem between doctors and patients in terms of behavioral things, explaining things, communication, etc. Now the demand is more. Now that everybody knows that we have to be careful while dealing with patients. The initial reaction was, even in my institution, the doctors, especially the junior doctors, under the influence of peers or parents, I don't know what, they were scared to go into the COVID ward. Even though when we gave them the complete PPE, etc., all the precautions. Because at that point of time, we were not sure what is the treatment, what is going to be the cure, what is going to be the end point of this virus. I'm talking 1 year back. And there was a real fear that if the infection comes to a medical person, it will be a severe type of infection and he will probably succumb to it. So we were isolating them for 2 weeks if they have just even seen a patient, not even be touched a patient. But now with the advancing knowledge of this particular virus, even though it is smarter than us, but still we have a vaccine. We have some protocols for treatment. Slowly the confidence has built up. Today I find in my institution, there is no hesitancy whether they are 67, 65 or they are 25-year-olds or even 20-year-olds nurses. They are boldly seeing the patient inside. They are talking to them, they're touching them, and they are also taking all the precautions. We have also involved physiotherapists to give them respiratory care, psychologists to counsel patients who have got long-term effects of the pandemic and the viral infection, and we are involving pharmacy interns for checking on the drugs. So we are trying to inculcate a culture of team working with the patient at the center of focus and build up that relationship in a much more longer way. This is one of the changes I've seen which happened in my institution. That fear factor is less now, although among the general public it is more. And during the second wave, which is the first of the two we had so far, we were actually overwhelmed by the huge numbers and the seriousness of the illness. But still, my young doctors were bold enough to treat. When every day there are 3, 4, 5 deaths happening in the ICU, but still they were bold enough to go in and see the patients. And that was something admirable. And that is the type of quality we need for a doctor to perform, even in adverse situations. Be the team leader. Thank you.
Right, that's very inspiring. Thank you so much, Doctor, for answering that. Now the flip side of it, I'm sure, Dr. Ravi Kumar, you've covered it, but there is a couple of questions actually on doing medicine online. For instance, there's a question about doing anatomy online, where you don't get access to the physical patient or the human body itself, which is so far recognized as a very important aspect of learning medicine itself. Maybe you'd like to indulge us and answer this question again, Doctor.
I'd love to, because I was definitely missing that part of training, which is not in the present day training itself. My colleagues here were all of the same vintage, almost there, and we all had an 18-month anatomy course where we had to actually physically dissect the body, the cadaver, and learn by dissecting each structure, feel each structure. What is the course of this nerve? What is the course of the artery? So that was the type of what we call it, involved learning we had. Then the medical council in its wisdom and the experts contributing, they cut down the period right down to about 10 to 11 months. What happened? So they don't have to dissect. Instead, they were shown dissected bodies, cadavers, and they learned from that. Did we find a change in these students? Knowledge-wise, theoretically, they knew everything. But when it came to actually doing a surgical procedure, they were hesitant to touch because they don't know what to expect. Secondly, there was some gap in the anatomy because of practical knowledge. How did we overcome that? That is where we try to use simulation and also make them do procedures along with us. So we have to go along, because this present curriculum doesn't give you that time for learning. We didn't have so many subjects during our MBBS to study separately and pass. So we had to actually telescope everything at that time. Now it is all diversified. So we need much more time, and 4.5 years is time given. So when they become a specialist, when they come for the postgraduate training, we find this difficulty. This is the downside of learning online or learning without actually performing a procedure on a cadaver. However, the plus side is that the technology is advanced so much. You can have virtual dissection platforms. You can have mentoring done during the dissection. You can have simulated, now the human anatomy is not only in pictures, it is in 3D. And actually when you touch a blood vessel, it starts bleeding on VR and AR, virtual reality and augmented reality are here. So the technology is pushing us towards learning without harming, without actually experimenting on a human being. So there's a plus and a minus. I would think going forward, we are going to depend more and more on technology, as has happened in the last 2 decades. Technology invaded the medical profession, and it will still continue to do so. We may not fully approve of it, but then we have to accept it.
That any of the other panelists would like to comment on this?
Yeah, of course. I mean, both Dr. Bhuvneshwaran and Dr. Ravi Kumar are actually involved in education rather than me, because I am mostly on the postgraduate education. Doing face-to-face education, learning anatomy as a group of people is very important. But one thing that the way we used to learn anatomy is a group of us used to sit down and look at the specimens and discuss it and explain to each other. It goes straight into the head. Otherwise, memorizing a large part of it becomes a waste and you forget it. But when you learn by discussion, that is good. That is completely absent here. But a lot of it is being compensated by advanced simulations and artificial intelligence. But I would still love to have the anatomy labs open and somebody demonstrating to you, and you are sitting with 5 people and learning it. It's very nostalgical to me. Yeah.
Actually, as MBBS students, we remember the theory classes where, it happens we can still do it through virtually. Because you have both the options. The class we used to, the backbenchers, sometimes people sleep, some attend. The same way it can happen in the virtual classes. But hands-on clinical examinations, where we have the clear-cut defined things like perception, inspection, palpation, percussion, auscultation, and so the feel, the touch, it's something like it can never be equated. Although I do agree with Dr. Rajshekhar that the advanced simulation techniques, even we have a very advanced simulation lab. But a simulation lab many a times can give you sort of a training aspects. Whereas again, a chance of like a group discussion which happens, it doesn't happen virtual mode always. Temporarily, I don't think we have an option now, but hopefully these things would become again later. It becomes probably something like an experience. That's it.
Right. Thank you so much. And we are nearly at the close of our webinar for the day. We've had some really interesting questions, and those of you who have asked questions, you'll find the answers in the Q&A chat box. Thank you, dear panelists, for being on this event. It was a wonderful learning for our students and for us in the Hindu as well. And I think there's a lot to look forward to with this new generation of doctors who are going to learn through different ways than was conventionally done with medicine. And thank you so much. I think this will be an important part of their decision-making process. Dr. Ravi Kumar, Dr. Rajshekharan, and Dr. Bhuvneshwaran, thank you so much for being part of this seminar, this webinar. And we'd also like to wish the young students good life and good luck with making your choices and entry into whichever course you would like to enter. Thank you so much.
Thank you very much. You do the same.
It was a pleasure to be associated.
Thank you.
Thank you, my dear Dr. Rajshekhar and Dr. Bhuvneshwaran. It was wonderful. On behalf of SRM, I thank you both for having participated. So the cardiologist's name is Dandapani. Dr. Bhuvaneshwaran, are you able to hear me?
Sir, what did you say there?
Cardiologist's name is Dandapani.
Oh, Dandapani. Oh, he was my colleague, senior colleague.